Clinical collaboration for nursing is fundamental. The nurse is the hub of the communication wheel in the healthcare space. Clinical collaboration is critical for a nurse. She needs to readily be able to access the other members of the care team without struggling to find who is on call, who is the right person to respond to her. And that needs to happen imminently in many cases because life and death, clinical care is at the center of what she's focused on. Being able to readily communicate and collaborate with other members of the care team, whether that's providers, physical therapists, nutritionists, the whole care team around the patient needs to be readily accessible to her. That's most important to the nurse because while she is the single point of communication from the patient, she then has to communicate out to the rest of the spokes. The speed at which clinical care is delivered today is much different than it was 10, 15, 20 years ago. The technology that has been brought into the healthcare space requires that there's a clinical collaboration platform that sits in conjunction with the rest of the technology in the space. With the technology in place today, those decisions are being made rapidly, and therefore nursing needs to be at the center of that communication. They need to be the reason why communication happens in such a real-time fashion. Those changes are made, and the nurse gets notified, and therefore communication has to immediately be quicker than it was historically. Nurses didn't go into nursing to spend their time documenting. We know there's been plenty of research that says 35% of a nurse's day is spent documenting. We went into it to do patient care. Having a clinical collaboration platform in play allows more of that time to be spent focused at the bedside and less of that time dealing with trying to find the right person on the care team that needs to respond to help your patient situation.